Good morning. My name is Dr. Vincent Siasoco. I'm a family physician in New York City. I'm a board member of the American Academy of Developmental Medicine and Dentistry. I'm the director of primary care at the Rose F. Kennedy Center at the Montefiore Health System. I'm an assistant professor of family medicine and pediatrics at the Albert Einstein College of Medicine. I'm also the chief medical officer of the Metro Community Health Centers, a network of federally qualified health centers here in New York City. I'm also a clinical director for Special Olympics and chair of the Special Olympics Health Advisory Council in New York. So I was asked to give this video and to answer just a few questions about myself and the IDD community. So first question was, how did I first get involved in the IDD community? Well, I first got involved with the IDD community while in college, actually. I was working part-time as a DSP, or a direct support professional. So I was the one that was involved with taking care of those individuals that live in a group home setting, taking care and helping them with their activities of daily living, whether it meant getting ready for programs, for school, helping prepare their meals, helping them get their medications in order, helping them get to their activities, their doctor's appointments, their dentist appointments. I was the one that would do all of those things on behalf and with the individuals. It was a wonderful experience that I had during this time, because I got to see firsthand how individuals with IDD lived, what supports they had, what challenges they had, and just their regular day-to-day lives. I was able to see that and help them with that. During this time, I also worked as a volunteer coach at the Special Olympics Games. Another question, how has my chosen specialty worked with the disability community? Well, unfortunately, it's obvious that one of the challenges for individuals with IDD is in obtaining quality health care. I noticed in my own experience going through medical school that there wasn't any education for myself or my classmates on how to care for patients with IDD, or even get to be familiar with what their conditions meant as a physician, and how I was to take care of them should I experience seeing one of them in my exam rooms or on the hospital floors. Though I've been working with this population, looking forward to learning more about this population since my pre-med days. I also saw this lack of exposure and training during my residency, unfortunately, as a family physician resident, when there was no available rotations for me to learn about this population. So much so that I had to actually put an elective rotation together for myself to get more experience. In deciding to become a family physician, I knew that myself, I'd be able to take care of the patient across the lifespan. I would be able to ensure the patient received the comprehensive and coordinated care that they needed. So I knew that I would be able to provide that for patients with intellectual development disabilities, knowing that there was a real lack of, again, training for physicians, or physicians being willing to want to do that. I learned how to take care of this population really by working with other physicians after residency who also serve this population and had the same dedication and passion. I worked for developmental disability agencies across New York City. So not only learning about their healthcare, but also other aspects of their well-being, where they lived, how they lived, what programs they went to, what type of schools they were able to get involved in, what kind of jobs they were able to hold down or look for. So right now, as I said, I'm currently the Chief Medical Officer of the Metro Community Health Centers, which is a network of federally qualified health centers here in New York City that take care specifically of the IDD population, patients with intellectual and developmental disabilities. So we're not only able to provide primary care, but also dental care and specialty care. In becoming an assistant professor, I also knew by doing that, I would be able to ensure that medical students and residents would be able to obtain the education and training that they would really need to take care of this patient population, whether they focused their career on this patient population or not. They were surely to be throughout their careers experience having to take care of somebody, at least more than a few, coming through to their exam rooms or their hospitals. I also connected with Special Olympics and underwent training to become a clinical director for their MedFest and health promotion programs. Another question, what would I recommend students and residents do to get more involved with the IDD population? Well, I would recommend to stay connected to organizations such as the AADMD, utilize their resources and connect with their student networks, get involved with Special Olympics in their own states, learn about the Healthy Athletes Program and how you can volunteer. I know it's difficult for all of us, especially during the time of the pandemic. There's not a lot of, or if any, on-site games. However, there's a lot of virtual programs and virtual events that Special Olympics is involved in. So it would be very valuable to look into those and see where you can get involved. Another way is also to reach out to other developmental disability agencies in your town, in your state, and see what type of programs where you may be able to volunteer. There's probably some right around the corner from you that you're not aware of, but I think that's a really good opportunity to get to learn about this patient population, again, how they live, their day-to-day lives, and get to know them as a person. So um, also, other things, as you learn more about the IDD population, as you go through your own training, keep in mind the importance of interdisciplinary care. It truly takes a village to take care of these patients. It sounds kind of cheesy, but it's actually true. As I said, I'm a family physician, but in addition to primary care, I have to ensure that the care that I'm providing incorporates also oral health care, behavioral health care, different types of specialties depending upon the needs of the individual. So it really takes everybody, all hands on deck to take care of this population. It's also important to keep in mind the social determinants of health and the different factors that have an impact on patients with IDD, the care and support that they receive. In addition to your chosen discipline and specialty in the healthcare field, you should also follow other interests and passions you may have that can enhance the care. So for example, I actually went back to grad school to get my MBA. I wanted to learn more about systems and organizations to see how I can improve upon them and contribute to them to improve the care of individuals with disabilities. With COVID and the vaccine rollout, I've been involved with advocacy with just wonderful families and colleagues and peers on the city level, state and national level, especially through the AADMD. So it will greatly help for you to get involved where and when possible to raise the awareness of the need for inclusive health for our patients with IDD. So I thank you for joining the AADMD student chapter and wish you all the best in your chosen careers and all best of luck. Take care. Thank you.